Good morning to you. Trust you're doing well. This is the AM show, and I'm Bernice Abubedu-Lansa. It's been an exciting edition so far, and we promise you more information and great content. Well, it's now time for me to have a conversation that on an issue that you may have thought about, and it's about herbal medicine advertising. So the Media Foundation for West Africa is organizing a public forum on this matter, and it is really concerned about how this is being done in this country. And joining me to help us understand the concept, why this is important, is Kweku Krobi Asante. He's comms lead at the Media Foundation for West Africa. Good morning to you, Mr. Asante. Great to have you here.
Pleasure.
Right, so I mean, this is not a new subject of concern, especially for us in the media space, where we've had discussions about what we allow for herbal advertising within the media space, what is permitted even from the angle of medicine, and what is, whether you can even advertise in the manner in which we go about it. Why is the Media Foundation for West Africa deciding to hold this forum at this time?
Well, thank you very much. Like you rightly mentioned, this is a conversation that is common, comes up often. I think last week, even on Joy, the radio, the conversation about pharmaceutical products on the market was being discussed. But a lot of times, the angle has always been about the products in the market, the regulatory lapses and gaps that has been discussed. But rarely do we bring in the media and also, as they say, bring in the people who are the watchdogs or the gatekeepers to actually talk about them and their contribution to what has become a big canker in the country, the proliferation of fake and unlicensed herbal products. Why now? Over the time, there was no conversation around this, and data was also missing to some point. But we did a study with the Communication Studies Department at the University of Ghana, the State of the Ghanaian Media Report, made some very chilling findings. And then on our own at the Media Foundation for West Africa, our investigative wing, the Fourth Estate, also have done some investigations and produced some documentary. Now the confluence of data, this tackling and ramifications of people taking fake products and unlicensed products, and then the investigations that the Fourth Estate have done that top media, popular platforms that we all consume are seeing marketing products that are not licensed, products that do not exist, fake products, and actually validating the products and at some point even misinforming people on and calling them to come and consume. So the confluence of all these, we think that this is the best time that we bring together stakeholders to talk about ourselves. Of course, who has to do that? By the Media Foundation for West Africa, who have been champions of press freedom, champions of media development. I think that if there's anybody who has to talk about curing the media from this problem, it is the Media Foundation for West Africa. The reason we are doing this.
I appreciate the point of validation, because here's it, especially in our part of the world, and I even dare say, in many other parts of the world, the media is a trusted source of information. And that's why it's important that we oftentimes have these conversations about ourselves, the media, and what we do. And referencing that report, the State of the Ghanaian Media Report by the Comms Department of the UG, is one that exposes the media in its, for lack of a better expression, naked self.
Yes.
This is who we are and what we must do to work at becoming better.
Yes.
Obviously, we are not better off as a society without the media.
That's right.
So tell me how this forum is going to happen.
Okay.
And what the end game is.
Okay.
Because that's the most important, isn't it?
So what we're doing is that we're bringing together all the major stakeholders. And when I say the major stakeholders, when it comes to the herbal medicine and traditional medicine space, the stakeholders are the Food and Drugs Authority, we have the Ministry of Health, we have the Traditional Medicine Practice Council, okay, all being stakeholders at the regulatory level. Then we have the media owners, editors, and top management of the media. We're bringing in also the academia to come and hold this conversation. Of course, the National Media Commission is in, the National Communication Authority, and all those bodies are brought together to take a deep dive into the conversation. Look, the studies show that 80% of Ghanaians consume herbal medicine or have herbal medicine as a source of health care. Then we see this data of also showing how many cases of kidney failures, many cases of, these number of cases of kidney that we hear, a lot of them are being attributed to how toxic herbal medicines that people are taking been contributing to that. Then on the side of the media, we see a lot of platforms allowing herbal medicine. For instance, instead of Ghanaian Media Reports saw that a quarter of the revenue that comes to TV stations come from pharmaceutical products, specifically herbal medicine. 22% of revenue that comes to radio stations in Ghana is from the herbal medicine. And so it's become like a cash cow. And as you know, advertising is the main source of income for the media in Ghana. And so anybody who brings it in, less structure to push against it, we open it in, whether they have FDA approval, whether their advert has FDA approval or not, we just put them on air. Sometimes LPM, the show hosts themselves are seen promoting the product, presenting it as if they have taken the product before, validating the product, and without any check or whatsoever. And that is extremely dangerous.
That's extremely dangerous indeed. And the other thing that we observe is that, because some of these people know that they don't have FDA approval, they don't produce adverts. They pay for a slot to come and advertise the product themselves. Exactly. And some of them may actually be running legitimate centers. When I say centers, so you have herbal centers, but may not necessarily be licensed to produce medication. So there are many angles to this, and thank you for raising this conversation. So how can the public be a part of this? Because the public consume these medications, so I'm sure that they are a major stakeholder in this conversation, and I'm sure people want to contribute or share their thoughts. So how do they do that?
So the program is happening. We're having a public forum on Thursday at 9 a.m. at the Kofi Annan ICT Center, which is just around the heart of Accra. And so we're inviting everybody to come through. We understand that this is a conversation that touches everybody. I mean, we all consume herbal medicine at one point or another. And so bringing all the stakeholders and the consumers together, we hope that everybody will converge. We make conscious and more workable recommendations that will guide how we advertise herbal medicine on air or in the newspapers or online, and how the regulators will also tighten up and ensure that people who come through to register their products or register their practice have gone through the scrutiny and ensure that they are credible and they will protect public health and people's health. I
hope we'll discuss the legal implications of all of this and how people may have to pay or have to suffer the implications of either flouting the FDA's directives or going all out to sell products that are not licensed for consumption. Thank you so much. Kweku Krobi Asante is Comms Lead at the Media Foundation for West Africa. Will this be streamed online for people who can't make it in person?
I think we are working
on that. You're arranging that, all right. So just look out for that program, which is happening
on Thursday
at 9 a.m. at the Kofi Annan ICT Center. That's around the GIJ Old Campus.
Yes.
All right.
Parliament,
so everyone is invited.
Yes, it's
you
open.
can come around and let's have this very important foundation. Comms Lead of the Media Foundation for West Africa sharing more with us. There's more right here on the AM show with me, Bernice Abubedu Lansa. Do stay.
Thank you.